Hello and welcome to this general election debate for Congressional District 1. This debate is sponsored by Clean Elections, the state's nonpartisan voter education agency. My name is Steve Goldstein and I'll be moderating today's debate. Thanks to a partnership with the Clean Elections Commission and the Arizona Media Association, we're working to make sure all 2024 debates are the most accessible in Arizona history. That means this conversation will air on a long list of local TV stations, radio stations, and digital platforms, including support from local newspapers. Our format will be a little different today. We're hosting a 30-minute one-on-one discussion since only one candidate has agreed to participate. The incumbent, Republican Representative David Schweikert, has declined our invitation. We'll welcome Democratic congressional candidate Dr. Amish Shah in just a moment. Transparency is critical here. That's why this conversation has been designed with input from a broad group of journalists in Arizona representing urban and rural communities. Thank you to voters across Arizona who've submitted questions. We've reviewed all of them to make sure every voice is heard. However, the candidate has not been given advance access to any of the questions. And with that, let's introduce the Democratic congressional candidate, Dr. Amish Shah. Welcome. Thanks very much for being here.
Thank you so much for having me.
You have 2 minutes for an opening statement.
Thank you so much. Hi, everybody. My name is Dr. Amish Shah. I am an emergency physician. I currently work at the Mayo Clinic and several other hospitals here in the state of Arizona. And I'm very proud that I get to do a job that I love. I get to save lives for a living, and we're there for people 24/7, 365. And we take care of anything that comes our way. And that career that I'm so proud of, it has only been possible because of the opportunities that I was given. There were people in my life, such as teachers and guidance counselors and medical school faculty, who saw something in me and said, you know, we're going to give you the opportunity to make your dreams come true if you work hard. And, you know, that's why I'm standing in front of you here today. And I wanted to make sure. People ask all the time, why are you running for office? Why did you want to get into politics? Because you're a doctor working with a practice and everything. And I said, it's because I wanted to make sure these values that we care about, uplifting other people and having their dreams come true, this is what America's all about. We want to make sure to transmit that to the next generation and keep this a place where dreams come true, like-minded. So that's why I ran for public service, purely for public service sake. So I ran for the first time in 2017 for the 18 cycle for the Arizona House of Representatives. I ran 3 times, I won 3 times, and I did this in a different way. I did this by knocking on people's doors. I've personally knocked on 22,000 doors to get to know the people of my district, to listen to them, to understand what they want, and then translate that into actual, real legislation that makes a tangible difference in their lives. So I figured if door knocking works to win elections, when I got into the Arizona House of Representatives, I went door knocking there. House, Senate, Democrat, Republican. I spoke to all of them. And because of that, I built real relationships. I was like the most bipartisan one down there. And you can ask any Republican politician down at the State House. Amish, they will say, Amish treated us with kindness and respect. And that's why I got more bills signed into law than any Democrat in over a decade in this state. And so I hope we get to some of the issues that we're going to talk about here. And I just have one last little thing to add, and that is the elephant that is not in the room. So obviously you can see I'm the only candidate up on the stage here today. I think it's really important that the American people get to see who I'm about and you know, my point of view, but they deserve also all of the input. And it's disappointing that my opponent chose not to be here with us today, because I think it's important that if you want the job, you got to show up for the interview.
Okay, Dr. Shah, thanks. So before we get to an issue question, then I'll ask you that question. You mentioned the elephant. David Schweikert, we're right there. What's the most important thing you could say to him?
What I would say to David Schweikert is that for me, it's that we have some differences and contrasts in our positions. And, you know, of course, he's not here, but I would say to him, okay, here's my position, and here's how I feel that it really represents the people of our district. One clear point of contrast. Women's reproductive rights. It comes up a lot, right, in our district. And what I've heard again and again is the government shouldn't really be in this area. So I'm pro-choice and proud of that. I have personally taken care of hundreds of women myself in the emergency department and elsewhere, and have seen what happens. Proud of that. Personally taken care of hundreds of women myself in the emergency department and elsewhere. into trouble and get into complications. And that puts me in a position where, given the laws that we have, that are being passed restricting these rights, what you're seeing is a person like me having to choose between fulfilling my oath to the patient that I took, the solemn oath to take care of each patient and give them their options, and going to jail. And that, to me, is why we don't make laws like this. So there's a clear difference there in what we believe in. And I'm sure on other topics we might have some points of agreement. But the other big one that I'll talk about is that he has said, I don't know his voting record like the back of my hand, but what I will tell you is that I am here to protect Medicare and Social Security, and what I've heard from what I know about my opponent is that those are on the chopping block there. And so we have some real points of disagreement, and I will defend my points of view to the voters out here so they can hear what I have to say.
Well, let's follow up on the abortion reproductive rights question. If you were to win this seat and you were in Congress and your caucus came to you and said, we want to codify the right to an abortion in the Constitution, do you think that is a good idea? Do you think it's going too far? What are your thoughts?
It would be difficult to do in the Constitution, but what I would say is yes, as far as a law that Congress would pass, yeah, I think we should codify what we had before, which was Roe v. Wade, and it gave people that, nationally speaking, across the country, that choice. And as I'm sure you've seen, people have suffered some untoward consequences. We've been seeing stories across the country of women ending up in sepsis. Those things wouldn't happen if that were the case. So down at the state legislature, my voting record was clear on this. I earned the Women's Health Champion Legislator of the Year award for protecting women's reproductive rights in 2022.
So let me ask you about Prop 139 in Arizona. Arizona's for abortion access. Without giving us, I know it's a secret ballot, but how are you going to vote on that?
Well, it's no secret that I did carry that myself. And so while I was on the campaign trail during this election cycle, I was out there and I was collecting signatures for it. And so I am in support of it. I think that once again, in the Arizona Constitution, that makes sure to codify that right for the women of our state.
Okay. You talked about your career as a medical doctor, so I want to ask you a couple of questions about that. Mm-hmm. What do you think of the current system of how Arizonans get their health care taken care of, whether it's the issues with insurance or the issues of provider availability? Give us your general thoughts on that.
Yeah, that's a really great question. Well, I have 2 minutes, and I'll just tell you, I could talk somebody's ear off about this because it's been my lived experience for 20 years, right? Medicine is frustrating for physicians, for nurses, all of us healthcare workers who work in the system, but also really the patients. It's expensive. We spend twice as much as the next most expensive country on earth. We leave some people out in the cold, and we have outcomes that are not as good as some of the countries that are out there. I kid you not, I have plenty of docs who are even Republicans or Democrats or independents who have told me this is broken, something needs to change. It's massively inefficient as well. So big goals, cover everybody, lower the costs for everyone, and stop making it such a patchwork system, and so try to make sure that we meet the needs where they are. The other big issue, of course, that I hear from our seniors, pharmaceutical costs, right? We pay higher costs than any other nation in the world, and our consumers are feeling that effect. So I'm proud that over the last year, what we have seen is the current administration did put in that $35 cap on insulin. I mean, that's something they really did at the federal level to bring down prices for households, for seniors in particular, and now Medicare will be able to negotiate drug prices and for a certain select number of drugs, and then they hope to continue on with that program. So I think there's a lot we can do. We at the state legislature, I did a lot. I was the ranking member on the House Health and Human Services Committee, and we did a lot. It was very bipartisan. I worked with many of the Republicans to improve our healthcare system for prior authorization, expansion of access, and I could go on, but the timer says I'm out of time.
Well, let me follow up on that then with your area of expertise when talking about lowering costs and covering everyone, and I presume covering them at the level of expertise and talent that we have in the medical profession in this country. That sounds like a lot. How does something like that get done in what is a very divided country, even if with the work you've done at the state legislature?
Yeah, but it doesn't have to be so divided, right? I mean, I'll tell you about my family personally, right? My parents are Trump-supporting Republicans. I grew up in a Republican household. When I was a kid in high school, it was like, you know, this was part of civics. We as part of a civics class, I volunteered for George H.W. Bush, the elder Bush, right? I became a Democrat later in the 90s. But, you know, this was the kind of spirit of cooperation that we remember from the old days, right? Before things got a little too divided. So, I mean, for me and my family, look, we've had, my sister and her husband are hardcore Democrats, and we've had a couple of rough Thanksgivings. I think, you know, what that might be like. But at the end of the day, we still love each other. And there is a moral in that for, I think, everybody, is that we don't have to do this. And I got to tell you, I'm going out there and I'm knocking on doors of everybody, and people are just, what I love about this is that people are willing to have those conversations with you and say, hey, I want to see where we agree and disagree, because people really care about this country. That's what's so magical about going out there to the doors and talking to the voters. So basically, to answer your question, what I'm saying is that I was surprised when I went down to the Arizona House how many of our Republican members, after they got to know me and we developed some trust, were willing to work with me on all kinds of issues, and we really did move a lot of this stuff forward.
Well, it's funny when you say this, because I think if we think about the outgoing U.S. Senator for Arizona who's not running for re-election, she worked in a bipartisan fashion, and yet people of her own party, your party, many of them became very frustrated with some of her actions. And so go with me on this a little bit, in the sense that people say they want bipartisanship, and then when someone actually carries it out, now that's the perfect example, but so you will be having to overcome some obstacles there. And can you reach enough people on the other side to actually get things done, is what I'm saying. State legislature, a lot of work there, of course, but it's a 90-member body. In the House, there are 60. There are 435 members of the U.S. House.
Well, I mean, I did come through a very strong field of Democratic primary opponents who are supporting me, and I'm hats off to them, and I thank them for their support in getting behind me on this. We were on this very stage. There were 6 of us, you know, a little while ago, and you know, the Democratic Party is behind me, and they know my record. So I will tell you that even though you may not, you know, on every bill, you'll get some disagreement down there. That's the way the process is supposed to work. But despite all that, I'm proud to say that my party is supporting me, and the voters out there are really supporting me and my party. And at the same time, there was a lot of bills that we were able to get passed with a lot of the Republicans on board, and that's all I can say is that I've still got the support of my party, and I was able to get all of those bills through the legislature. Many of them, the ones that were in my name that were signed by Governor Ducey, all through a Republican legislature, were in fact health bills. So you know, it is possible to do it.
A lot of other big issues to get to. Is the U.S. facing a border crisis right now? And if so, what are some steps you'd want to take in Congress to help fix that while also being humane?
Yes, the country is facing a border crisis. If you look at the numbers that have come in over the last 3 to 4 years, it's large compared to what was before that. And that overwhelms our system for processing. It also creates a safety problem for people in the local areas, as well as cost and social services problems, as the number of people overwhelms a particular community. And that's what we've heard. So I've said to people, I'm going to secure the border. You can look at my record in the state legislature. In 2022, I voted for the fiscal year 23 budget that appropriated $209 million for border security. In 2022, we also had HB 2591, $250,000 for the Border Security Fund. One of the other issues that comes up is fentanyl coming across the border, which I have, as a physician, seen myself personally. And it is a tough moment when you have to go speak to family members about something fatal that happened because of this deadly drug that's coming across our border. So in 2022, I was the only Democrat in the House or the Senate to vote for HB 2253. This was a bill to lower the felony threshold for fentanyl because it would have lowered it to 9 grams, and from my medical knowledge, I know that could have killed 4,500 people. So that's why I knew, and I voted for that bill to crack down on fentanyl dealers. So this is a problem that's being felt not just in Arizona. Of course, we're here on the border, but all over the country as well, and that really needs to get done. So a lot of what's happened is in the last few months, you've seen that the current administration has shut it down to some degree. They've limited, I think, the 2,500. And then we have that bipartisan border bill that's out there that serves as a framework. It was written by our Senator Sinema, as well as a very conservative Republican from Oklahoma and a Democrat from Connecticut, if I'm not mistaken. And so that's a really good framework for us to start and, again, work in a bipartisan fashion to fix this.
So we're talking about the federal issue in this case, but I want to ask you briefly about the state proposition, Prop 314, which some are saying reminds them of SB 1070, which was very draconian, some would say, also put the state in a poor light, others would say. Prop 314, there are certain provisions I suspect you support, but overall, do you support it?
I mean, I think we're still sort of looking at that and saying, look, it may be exactly that, the kinds of things you talked about, which I'd be concerned about. So put the state in a bad light, but also do more could it help us do more to stem the tide, if it's not getting done? There are some positive aspects to it as well. So it's I think we'll leave that to a little more study.
Okay. Philosophically, do you think it'd be better off if we divided border security from legal or illegal immigration as opposed to always lumping them together? Could we find solutions in a better way and perhaps more quickly if we divided those into, here is protecting the country, here is seeing who wants to come into the country, whether for economic reasons or other reasons?
Yeah, so, if you look at the groups of people that are showing up, it's that we have the asylum-seeking system, which is the most abused. And that is where people are getting very frustrated because there are people coming from places like India, which is where my parents are from, but they're coming and circumventing our normal legal process. The legal immigration system also has a really bad backlog, and we've heard everybody complain about this, especially our business community, saying, look, we need the labor. Can we please, prioritize some of these folks in some industries and areas where we might need help? Look, in the 1960s, my parents were engineering students. At the time, the U.S. needed a lot of engineers, and so they came and were given an opportunity at the Milwaukee School of Engineering, which is where they met, by the way. And so it was, it's why I'm standing here today. And so I think that we really would do well to stem the illegal part of it and then make sure the legal immigration system is working really well and people get processed in an expeditious way so that we can do what we need to do for the United States of America to compete going forward in our economy.
Well, let me segue from that into the economy then. Stock market's doing well. Unemployment is low. Inflation has gone down from its peak, certainly. What would you say to someone who has to work a couple of jobs, is still especially concerned about how things are going, and they said, well, I see the numbers, but personally, for me, the economy is not doing well. Give me some ideas you would have in Congress to help make a better cost of living for your constituents, et cetera.
Yeah, I think you kind of hit it on the head. There are statistics, and some people have said in the political world, well, these statistics are all out there and they look great, so why is everyone complaining? And my answer to that is, go out there and speak to people. Go knock on 22,000 doors, and you'll see that it's uneven. And if some people are feeling the pain, then your job as a politician is to go out there as a public servant, is to go out there and listen to them and try to address their concerns. So I've heard it. The price of milk and gas and eggs and food has really risen, right? And whether you're a Democrat or Republican, the government doesn't have a magic lever to pull prices down in this economy. But there are some places where the government could make a difference. And I think that's where it's a smart thing to do to make a difference for people. I talk a lot about housing, and that is a huge problem here in the Valley. We don't have enough supply. We have people moving in, and that means, I was an econ major, that means that prices rise. And rent, as we all know, has gone up tremendously. Here in the Valley, people are upset, especially my group of 20-somethings who, some of them are on my team, and they're like, you, Mr. Gen Xer, you moved out and you got an apartment way back when, but I'm in my mom's basement because I can't afford the rent that's out there. And that's where you got to pay attention to people. And that you can only get that by going out there, knocking on doors, meeting people, and hearing their stories. So I think this is where we can make a difference. Cutting regulation to try to get builders and developers to put more stuff into the ground, shovels into the ground, more buildings coming up quicker, and also increase the supply. So there's other policy options in there as well.
Let me ask you about tax policy. Is there a tax policy you'd support that you think would help some of the folks you're talking about? There's discussion of extending the so-called Trump tax cuts. General tax policy, what do you think?
I mean, I'm not in favor of extending the Trump tax cuts because a lot of the folks that were helped by those were wealthy, on the very wealthy end. And the folks who are less wealthy did not benefit nearly as much as people on the upper end of the scale. They may have received some benefit from it. And again, same thing, it was very uneven. So, we had provisions in there like the state and local tax exemption. So that is where I have a real problem. I don't want any tax burden on the middle class, certainly, but I think that there are some things we can do at the upper end, people making more than 500 or $1 million bucks a year, where we could really help fund some of the priorities that we have.
I don't want to give you whiplash, but we only have a few minutes left, so I'm going to try to get through some major topics fairly quickly. We've all seen back-to-back summers, record high temperatures here in the Valley. It's affecting other parts of the country as well. So whether it's human-caused or cyclical, the climate has changed, and that's going to affect the desert Southwest in a really impactful way, as it already has past couple of summers. What are your thoughts on changes to the environment, ways to improve it, ways to keep people from being affected dramatically by this?
We live in a desert. We love it here. I love it here. And we are looking at temperatures rising. As you know, it's now first week of October, and yesterday I checked, it was 106. And it's going to get harder and harder on us. One of the big ways in which, besides just the ambient temperature and the heat and the summers getting longer, which are already tough for a lot of us, is that water, it becomes a huge problem. Our economy here depends on us having more water in order to get more residential development, even the fab plants, Intel, TSMC, the CHIPS Act, brought in here. They brought in jobs. They are creating prosperity for us, which is really great. But if we don't watch the water supply, then we've got a problem. And why is that dwindling? Because the planet is heating. And the snowpack in the Rockies is not what it used to be. Glaciers melting, less acre feet running down the Colorado River, Lake Mead and Lake Powell at historic lows. And now that means less for all of us here because we get our our water through CAP, the Central Arizona Project. So it's going to become a bigger and bigger problem for us. Now, my first vote in the legislature was the Drought Contingency Plan. And we did this in a bipartisan way to push more water in there. It was about, it's been about 5 to 6 years since then. God, we thought it would stave it off for a lot longer, but it didn't. And we're already back in a state of worry again. And so we have to think about our water future, and we have to fight for Arizona in this way.
I need you to be very brief on this one. You're going against a candidate who has been in Congress for nearly 15 years. and won by a very narrow margin the last time around, but he still did win. If you can do this in a minute for me, what's your path to victory?
Well, my path to victory is well, number one, to show up here and to speak to the people at home and tell them, here's who I am, ask me questions, get to know me and understand who I am, why I entered into public service, and to show up to do the job. I showed up at 22,000 doors. And I think it's important to show up on the debate stage, to communicate your ideas well. It's what we owe to the people out there, to tell them our views, how we are going to be your representatives in Congress. You know, a lot of it also comes down to, yes, of course, there's you know, running campaigns is more about logistics, execution, all those things you do right. My team is amazing, and we get out there and we make direct voter contact. We want to shake their hands. We want to get into discussions with them and understand them, to represent them. That's always been my path to victory.
Just a few seconds, very quickly on this one. Logistics, you mentioned it. Are you getting national support, and is it helping you at this point?
Yeah, so I'm very proud to report that we have folks coming from all over the country to support our campaign. Of course, this is a very competitive race. You know, the polls show very, very tight margins. And so people are very, very interested from all across the United States.
Thank you, Dr. Shah. Now it's time for your closing statement. You have 1 minute.
Thank you. Thank you so much. I really appreciate the time here that we got to spend. You know, we can't cover every single issue under the sun, but I hope to give you a little sense of who I am, how I've spent my time over the last 7 years serving the people of Arizona in the state legislature. You know, I cannot harp enough on the bipartisanship. I was the most bipartisan one down there. I have a Republican who I served with down there who is endorsing me in this race. I've been endorsed by the Arizona Police Association because I supported them back when it wasn't as popular in my party and it ruffled a little bit of feathers, but they're supporting me. The Arizona Police Association is supporting me in this as well. So I think it's important, like I went to 22,000 doors to show up and to listen and to heal the divide that we've had in this country. And so all I can tell you is I would love to earn your vote, and I thank you so much for your time and attention.
Dr. Shah, thanks so much.
My pleasure.
That's all the time we have for our one-on-one conversation with Dr. Amish Shah, Democratic candidate for Congressional District 1. As a reminder, Arizona's general election is Tuesday, November 5th, and early voting starts Wednesday, October 9th. Head to azmedia.org to see a list of upcoming debates and where you can find them on TV, radio, and digital platforms provided by our local media partners. For the full debate schedule and to submit questions for future debates, head to azcleanelections.gov. And on behalf of our partners at Clean Elections, the Arizona Media Association, Reister, and Bitfire Studios, thanks so much for joining us.